Endometriosis is a common health problem in women. It happens when tissue, similar to the lining of the uterus, grows outside of the uterus. In endometriosis, this tissue grows in other places. These places can include the ovaries, fallopian tubes, and the lining of the pelvis. It thickens, breaks down, and bleeds each month with the menstrual cycle. This can cause pain, inflammation, and other problems. Endometriosis can have a big impact on a woman's life. There is no cure, but treatments can help manage the symptoms. The exact cause of endometriosis is unknown. This is a question that researchers are still trying to answer. However, there are several theories. One theory is called retrograde menstruation. This is when menstrual blood flows backward, through the fallopian tubes and into the pelvis. This blood contains endometrial cells. These cells can implant and grow outside the uterus. Another theory is that cells in the abdomen can change into endometrial cells. This is called metaplasia. These cells can then grow and cause endometriosis. Genetics may also play a role. Women with a family history of endometriosis are more likely to develop the condition. Some researchers believe that problems with the immune system might be involved. The immune system normally attacks foreign substances in the body. However, in endometriosis, the immune system may not be able to destroy the endometrial tissue growing outside the uterus. More research is needed to fully understand the causes of endometriosis. Finding the cause is important. This will help develop better ways to prevent and treat this condition. While any woman can develop endometriosis, some factors increase the risk. One significant factor is family history. Women with a mother or sister with endometriosis have a higher chance of developing it. Early menstruation is also linked to higher risk. Girls who start their periods before age 11 are more likely to develop endometriosis. Shorter menstrual cycles lasting less than 27 days and heavy periods lasting more than 7 days are also associated with increased risk. Never giving birth is another risk factor. On the other hand, some factors seem to offer protection. Pregnancy, especially multiple pregnancies, is linked to a lower risk of endometriosis. Extended breastfeeding for 6 months or more also appears to be protective. The use of combined oral contraceptives, which contain estrogen and progestin, is associated with a reduced risk of endometriosis. Interestingly, smoking has also been linked to a lower risk, although this is not a reason to start smoking due to its other harmful effects. Section 4. Recognizing the symptoms. Endometriosis can manifest differently in each woman. Some women experience no symptoms at all, while others have debilitating pain. The most common symptom is pelvic pain. This pain can range from mild to severe. It can be constant or come and go. Pain is often worse during menstruation and may radiate to the lower back and legs. Painful periods, known as dysmenorrhea, are a hallmark of endometriosis. Pain during or after intercourse, called dyspareunia, is another common symptom. Some women experience pain during bowel movements or urination, especially during their periods. Other symptoms include heavy menstrual bleeding, bleeding between periods, infertility, fatigue, diarrhea, constipation, bloating, and nausea. It is crucial to remember that the severity of symptoms doesn't always correlate with the extent of the condition. Some women with mild endometriosis experience severe pain, while others with extensive tissue growth have minimal discomfort. Diagnosing endometriosis can be challenging. Symptoms can mimic other conditions like pelvic inflammatory disease or ovarian cysts. There is no single test to diagnose endometriosis. A detailed medical history is taken. A pelvic exam checks for abnormalities. Imaging tests like ultrasound or MRI may be used. Laparoscopy is the gold standard for diagnosis. While there is no cure for endometriosis, various treatment options are available to manage symptoms and improve quality of life. The best approach depends on the severity of symptoms, the woman's age, and her desire for future pregnancy. Pain management is often the first line of treatment. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce pain and inflammation. For more severe pain, a doctor may prescribe stronger pain medications. Hormone therapy is another common treatment option. Hormonal contraceptives like birth control pills, patches, or vaginal rings can help regulate hormones and reduce endometrial tissue growth. Other hormonal medications such as gonadotropin-releasing hormone, GnRH agonists, and progestin therapy can also be effective in managing symptoms. Surgery is an option for women with severe symptoms or those who haven't found relief with other treatments. Laparoscopic surgery can remove or destroy endometrial tissue, improving pain and fertility. In some cases, a hysterectomy, which involves removing the uterus, may be recommended. However, this is usually a last resort, especially for women who still desire pregnancy. For more information, visit mdsearchlight.com. MD Searchlight. Be your own advocate.